Okay, so now as program director at Harvard, you get 400 applications and you're interviewing 30 some people or whatever the number. How many people do you interview and how many applications do you get?
We got 355 applications this year, and I know because I reviewed them in the past 2 weeks. And we are going to interview between 32 and 34 people, I believe.
Right. So that's exactly where we are. And so when you're looking over those applications, what are kind of the things that you use to decide, these are the applications that really stand out to me in a positive way? Are there any kind of red flags that you also look out for? But those are kind of like my two big questions.
Yeah, like common mistakes on applications and stuff.
Well, I don't know that necessarily there are a ton of mistakes that people make in applications other than not preparing it really, really carefully. I would say, and this doesn't really happen that often, but like super silly grammatical errors or spelling errors, I think is an unforced error that it just requires a
Yeah.
little bit of, that shouldn't happen. And that's pretty unusual. So it's sort of almost a moot point. The things that I look at a lot that I think are very important are letters of recommendation, and
Mhm.
particular letters of recommendation from people that you know, and people that know the sort of barometer here, get the difference in the different applicants and things like that. Somebody who is an incredible plastic surgeon in private practice who writes one letter of recommendation every 5 years is going to write a perfect letter of recommendation for the person.
Yeah.
But it's hard to know how that compares to the other applicants. So I really value.
Welcome back to the DIEP. Today, we're joined by one of the true leaders in extremity reconstruction and hand surgery, Dr. Klye Eberlin. Dr. Eberlin is the program director of the Harvard Plastic Surgery Residency and associate director of the MGH Hand Fellowship. He's been honored as the ASSH Plastic Surgery Visiting Professor, the ASPN Traveling Fellow, and he currently serves as president of the American Association for Hand Surgery. In this episode, we get into why he loves what he does, his best advice for applicants and inspiring hand surgeons, and the passions that keep him balanced outside of being program director and outside of the OR, from squash to chess. It's an insightful, energizing conversation with one of the most respected educators in our field. Kyle, thanks so much for joining us. Let's dive in. Tonight is a night we've all been really looking forward to. We've had a lot of recent requests to talk a little bit about, more kind of geared towards applicants, applications, residents, how to be a good resident, all the above. And we're fortunate to be joined by Dr. Eberlin, who's a program director at the Harvard Combined MGH Brigham Plastic Surgery Program. So, if there's somebody to be able to comment on a lot of these questions that we've gotten, he's the perfect person. Also to kind of shine some light and share some of his pros regarding leadership. We're really looking forward to this. So, Dr. Eberlin, thank you very much for joining us tonight.
Thank you.
Yeah, thanks a lot for having me. It's going to be great.
Yeah, I sound like a broken record, and sometimes when I hear myself say this over and over and again, it's kind of nauseating. But one of the things that really drew Hank and I towards starting this is because oftentimes I feel like conferences become broken records, and you're hearing the same talk over and over again: lower extremity reconstruction, upper extremity reconstruction, whatever it is, and we fail to really hear other stories that are perhaps equally important but different, like upbringing, challenges, regrets, mentorship, and things like that. And so it really excited me and Hank, and really the credit goes to Hank for this initiative to be able to hear these stories that we don't really get to talk about. And so kind of drawing from that, somebody like you, Harvard trained and now is the program director at one of the top and most reputable programs, perhaps in the world. If you look back into your childhood, how would you kind of describe your upbringing and your path towards medicine and plastic surgery? Is it one of those things where you, like, as a 4-year-old, you knew you wanted to be a surgeon?
Definitely not, actually. I grew up in Buffalo, New York. My parents were middle school teachers, and I grew up with a younger brother who, by the way, also is a plastic surgeon. And I really wasn't
He
sure exactly
practicing?
he is. He's practicing outside of San Francisco in
Wow.
private practice. He's got a busy cosmetic practice and doing really well. So yeah, I in high school, I applied to a 7-year medical program, which is kind of, you get into medical school more or less out of high school and do 3 years of undergraduate and 4 years of medical school. And I kind of did that, not really knowing where it was going to take me. So I sort of had an idea that I might want to do something in medicine, that clearly, if I applied to that program, but I didn't know anything about plastic surgery. And I didn't know much about it even until I was in my third year of medical school, actually.
Yeah. So when you decided plastic surgery, obviously another thing that we love about this podcast is it brings the different disciplines within plastic surgery together, which is something that we don't see. We're all disjointed at different meetings a lot of times. But was the thing that drew you to plastic surgery the obvious answer, hand and peripheral nerve, or was it something else? And I'm just curious, how that sequence of events went.
Unequivocally, no. I went to plastic surgery absolutely convinced that I was going to be a pediatric craniofacial surgeon because my first exposure to plastic surgery actually was on a cleft lip and palate type mission as a medical student. And I thought it was really remarkable, just really that the technique of a cleft lip repair and the three dimensionality of it.
You
And I
sound like
thought,
you're in the middle of a plastic surgery interview, like as an applicant. Like this is like every
yeah,
applicant story.
but it's actually true.
Yeah.
And I was like, this is really cool. And so when I came back from this medical mission, I said, what is this plastic surgery thing that I knew nothing about? How do I find myself as a resident plastic surgery? And then I realized, by the way, it's really hard to become a plastic surgery resident.
Yeah.
And so the short version of the story is I went to Boston University School of Medicine, and no one really went into plastic surgery because there was no residency program, et cetera. And through a friend of a friend, I actually had lunch serendipitously with an NYU plastic surgery resident named Chris Derderian, who happened to be in
Craniofacial.
Boston, craniofacial surgeon. And he said, oh, he told me so much about plastic surgery, about how to get in. And that's when I decided to take a year to do research. So that's how it all kind of snowballed. Well, I definitely owe a lot to many, many people, as most of us do, who get into this amazing field and have careers that are where we're able to contribute to the field. And I would say the one person who really stands out is Dr. Jay Austin at MGH. And the way that this all fits together is and it's funny now being on the other side of these things, but I cold emailed him basically saying, hey, I'm a medical student. I really am interested in considering some research. I'm willing to work as hard as I possibly can. I'll do whatever it takes. I don't need any funding. Can
All
I
the
come work in your
buzzwords.
lab? Right. Those are the buzzwords, right? I guess I didn't realize it at the time, but it was apparently a successful pitch. And he was kind of starting his career as a relatively younger attending. And we met and he let me join his research group, and that's how it all started. He has been just a great mentor over the years. I can recall very early on, when I just started joining the research group, he's a busy guy. He's got a lot on his plate. And I was definitely an ancillary part of this whole enterprise, right? Like, I don't think anyone really paid attention to me, but I put my nose down. I worked hard. I learned as much as I could about research. I had no experience. And I started writing papers and I attended grand rounds. I attended conferences as the fly on the wall. And over time, he trusted me more. I believe I had to earn it. I think that was probably the right way to do it. I shouldn't have been trusted immediately anyway. But yeah, and he's been very, very impactful for me as a mentor over the years.
Yeah. So I have to ask, because, and this is a little bit out of order, but this has become such a hot topic now, and you kind of like put a check mark on all the important aspects of why a research year could be very impactful on your future career. And you mentioned obviously the mentorship and alongside that, the productivity. Looking back, it sounds like to you it was a no-brainer that if you had to do it all over, you'd still do a research year. But can you help kind of guide others as to, I had somebody even today ask me, why should I do a research year if I want to get into plastic surgery? So what would be your answer to that?
Well, I think it's a very individualized decision. I mean, for me, in retrospect, it was very easy. I didn't know anything about plastic surgery. I was completely underprepared to match into plastic surgery, aside from having a reasonably good step one score. I remember talking to my family and my wife. We were either engaged or very close to being engaged at the time. And everyone thought I was crazy. They're like, why would you take another year? It's a long enough process.
I know.
You X score on step one, like that should get you into plastic surgery residency. And so at the time, it wasn't a very popular decision, frankly. But in retrospect, it was definitely the right thing. I learned about the field. I was able to be sure to some degree that this is what I wanted to do and to figure out that there would be some avenue. But back to the question you asked, I think it's an individualized decision. Some people don't need a research year. They've already engaged in the specialty. They know about it, and they may have good enough mentors or mentors that are involved enough to really help shepherd them through the process. But then some people would be very useful. So I think it's an individual decision.
I think one of the key factors, especially for me, I went to Temple for medical school and we don't have an integrated plastic surgery residency program. So I feel like a lot of people who don't have a home program, it's very beneficial, obviously, for networking and building relationships and getting involved that way. It's definitely been more beneficial for those candidates as well.
Yeah, it's tough, right? Because those folks and those students who go to schools with very reputable, established plastic surgery academic programs are at a bit of an advantage, and that's just the way it works. And I guess I would say to somebody is not in that position, which was myself, that there are ways to do it. You just have to be strategic about it, and you have to really think deeply about how to navigate that path into where you want to go.
Yeah. Now, I wanted to ask one more question sort of about mentorship and being the program director, which we're going to talk about in a minute. Obviously, you're incredibly, incredibly busy. And on top of that, you're an incredibly busy surgeon. You're traveling all around, giving talks. How do you find time for mentorship? I know people have many different algorithms, but how do you find time between being super, super busy clinically, academically, to take a second here and there for mentorship? Is there any advice that you'd give to others?
Well, I think mentorship is just so unbelievably important. And as I said earlier, all of us, myself included, have benefited from those ahead of us who have given us great advice and have helped us get to where we are. So I feel very strongly that that has to be an integral part of being an academic surgeon. So whether that be very early in the morning, and I'm a pretty early riser, I get to the hospital before most of the residents do,
What
or
time?
whether it depends on the day, but very often I'm in my office by 5:30 most of the time, sometimes before that, because truthfully, and not to divert the conversation, but my family is still asleep at that time, and I learned from actually some of my mentors in hand surgery, Jesse Jupiter and David Ring, that if you want to be productive, that's a great time to do it, because
5 a.m. club.
there's no opportunity cost with regard to your family relationships, right? They're asleep. And so I drive into work. I've got a certain period of time of dark peace as I'm driving, and then when I'm there, I have a cup of coffee, and the wheels start turning a little bit. So whether it be at that point in time early in the morning, whether it be on the weekend, whether it be in between cases, like there's many opportunities to be a mentor to somebody. That's not just here's how you do an operation.
Yeah. This is all about diverting conversation. So that's the whole purpose of it. So but I started the whole 5 a.m. routine as well, getting up at like 4:50, starting the day at 5. And it's funny because at once I was kind of shifting online and I saw this book about the 5 a.m. club, and it has made a drastic difference to have those 2 uninterrupted hours at the beginning of the day. Like you said, when you're not distracting from family time, it's been a game changer.
It's tough to do it, truthfully. If you're in it for the long game, anyone can do it a couple days in a row, like congratulations. But to do it sort of routinely over an extended period of time to really put in the work, that is how I think it becomes meaningful. And it's not for everyone. I never was a morning person. If you told me in college that I'd be waking up early and getting to work, sometimes at 5 or before 5 a.m., I would have told you you're crazy.
Yeah.
But here I am. Maybe I'm getting old. Who knows? But
No, our lives are so funny. I was talking to my neighbors the other day, and none of them are in medicine, telling them that at the time that I was waking up in the morning, and they all nearly like fainted. It's crazy. Anyone outside of medicine just doesn't understand.
there are some advantages, though. And in fact, as an aside, I have some really good friends from high school, none of whom are in medicine. And once a year, we get together in the summer and we go like tuna fishing, and it's super fun. It's a weekend of, sort of guys trip. And to go tuna fishing, you have to be on the dock at like 4:15 in the morning.
Yeah.
Oh my
And
God.
I'm like up, ready to go. I'm like, okay, time to get started. And they're like, what are we doing? Why are we getting up so early? So
That's
there are
funny.
some advantages. I
So it
guess.
sets you up for tuna fishing success.
Yeah, exactly.
Yeah, to all those listening. So going back to BU, did you ever envision yourself as someday I'd want to be a program director? And people call it the thankless job, I think. But as the associate PD at Penn, like I find I'm very grateful for the opportunity. I've really enjoyed it. It's a lot of work. But thinking back, is that something you always aspired to do? Did you kind of fall into the role? And then what's kind of been the most rewarding and most challenging aspects of being the program director at such a prestigious institution?
Yeah, I mean, I've always been quite interested in education and teaching. Perhaps that comes from the fact that both my parents were teachers. But, the way that I sort of found my way into the role of program director was I got quite involved early on in our program. I was interested in help building educational curricula. I got involved in kind of running our grand rounds. And so just found myself more and more involved. And actually, it's a little complicated, but the program director role in our program was theoretically supposed to rotate between different hospitals
Yeah, I
because of the
remember that.
nature of our program.
Yep.
And after there have been two program directors before for me. One was Julian Prives, my program director when I started, an amazing guy, and Mike Yarumchuk, an expert craniofacial surgeon. And so when he was sort of getting ready to sort of step down or thinking about it, a woman with whom I'd worked very frequently at the Brigham at the time, Steph Caterson, who's wonderful, she was going to step into the role as program director, and I would have been very enthusiastic for her to do it. But she at the time left to go to a different practice. And so here I was, I guess at the time I was 5 or 6 years into practice, and I was the person who had the most internal knowledge of how the program worked, had done the most work as kind of site director. And so I saw there was an opportunity, and I said, well, I would love this challenge, and I feel very grateful and honored that I've been able to do it. So it was a bit fortuitous in some respects that it kind of worked out like that. But there are challenges. I love doing it, as you said. I don't know, I'll call it 99%, but that's probably not right. Is a very rewarding.
Would it be higher?
Very rewarding. No, it wouldn't be higher. Yeah, I would say the vast majority of time, it's incredibly rewarding. I love seeing people and trainees kind of come through the process. I remember many of them that were sub-Is and they're now graduating, and that's why we do it, right? We love seeing people succeed and become great surgeons and taking good care of patients, et cetera. But not for nothing, there are always challenges. And whether it be individual needs of different residents, all of whom are different, right? There can be family things or personal things. Those come up, of course. It's our job to be able to navigate that in a successful way for them. We have the perhaps great honor of having a union come to our program in coming years. And, I never thought I would have to talk about whether people could get Uber tickets on their way home from call. That hasn't been a high interest of mine in sort of managing the program. But you get the point that there's some things like that just come up, and you got to deal with them.
Yeah. And in some ways, you're like the coach of a football team or a sports team, and you kind of have to bring everyone's individual goals together for like a collective goal. So I'm curious how you would define success, as a whole for a residency program or at Harvard.
Yeah, I'm going to answer that question. I would say one other challenge that I've become more aware of in the past, certainly the past year, but maybe the past year or two, is when you start out as program director, you're kind of bright-eyed and bushy-tailed. To some degree, you're kind of friendly or friends with the residents, and that's a good thing, and that's important, and you need to have a good relationship with them. But it is interesting that the more you're in the role, and the more you're in the role over time, you have to kind of be the parent to some degree.
Yeah.
You transition roles a little bit.
You do, and there's a dichotomy there, right? You can't be the overbearing tiger parent all the time, but you can't be a pushover either, right? No, you can't eat chocolate in the morning and watch TV all day. Like you can't do that. I'm sorry.
Yeah.
And there are some rules that are immutable, right? That's sort of the deal. So there are challenges there. But the question you asked, Hank, is how does one
So when you went into being the program director, you said you're like year 5, 6 into practice. So then probably some residents still were calling you Kyle.
They all do. Still.
Yeah.
They all do.
But even
they still call me that. I demand it. And there's a reason for that. I remember Dr. Prives, Julian Prives, ironically, I'm calling him Dr. Prives, but when he was program director, he made everyone call him by his first name. And I couldn't bring myself to do it. I was like, that's not a thing. I can't do it. But I think you earn respect. It can be given to somebody, but I think you earn it. And so I do still have the residents call me by my first name. But you are right. I was much closer to their level at that time than I am now.
It is interesting. And then as you get older and the residents start to graduate and then new ones come in, or even naturally, your relationship changes even without you wanting to,
Yeah. No,
Defining success. Yeah.
Yeah, I think there are many ways to define success for a residency program. And what I tell applicants all the time and sub-Is and people is like, there's a lot of great programs out there, right? And there's no absolute best program. Everyone's a little different. The culture can be slightly different in different places. But I would say the way I would define success for our program is having a cohesive collegial group of residents that work together as a team. They work hard, they take great care of patients, and that many of them want to become leaders in plastic surgery in some way, shape, or form. That could be a leader in their community. It could be a leader on the national stage. It could be a leader of running an international group that does great work across the globe for folks that need it. Like there's many ways to define leadership, but I would say that all of those things are the way I would define having a quote successful residency program.
And I think just thinking about the Harvard program, when you get to that level, we think about like the competitiveness of matching into plastic surgery. And when you're at that level, when you're at the Harvard level, you basically kind of check all the boxes again. I've interacted with a few of your residents recently. One past graduate who was a college football player, we hung out at ASPS, and then Tina, who's going to Memorial Sloan Kettering for microsurgery, and I could name numerous other ones that are just like such great people, fun personalities, but you can tell incredibly motivated, incredibly hardworking. What do you think, if you had to kind of put in a plug or talk about your program specifically, what do you think you're most proud of in establishing as your time and program director in terms of distinguishing its culture and environment?
Yeah, it's a good question that I think perhaps a little hard to answer. I would say that culturally, I think we have a much more friendly program now, perhaps than it was, in a program in which I think the residents get along both professionally and personally. And I think that's very important. When I was a resident, I'm very proud to have trained in our program. It seemed a little bit more disjointed, perhaps because we were going to more hospitals too. But I think I'm proud that we have excellent culture and a good team effort where everyone kind of chips in and works well with each other. I would also say that I feel strongly that a very important part of surgical training, and this is the opposite of being fluffy about it, is like technical surgical excellence, like unequivocally. I'm definitely willing to be as nice as possible, but I think all of us demand excellence, and there's no substitute for it, particularly because it matters for patient care and patient outcomes. So I think imbuing a sense of that into trainees is really, really paramount.
Yeah. I think it's also important to, bringing up that point, there's just, especially nowadays, there's so many distractions for a trainee. There's an unlimited amount of distractions. And just to reemphasize the fact that you're going in this to be the best possible technical surgeon and to take the best possible care of patients kind of allows you to refocus your efforts. Everything else is a plus. Before you, we've interviewed numerous leaders in the field who all say the same thing. Focus is being the best surgeon, and then you can start to kind of dabble. I think the issue becomes is when people start to get distracted and start to veer off the track. You know what I mean?
Yeah, I think it's a very important point that often gets overlooked in our era of social media and all these shiny little things, subjects that are being dangled in front of our faces all the time. But putting your head down and just saying, I'm committed to being the absolute best surgeon I possibly can be, and I'm willing to do whatever it takes to get there, I think is really, really important. And I know that I'll tell a very brief story. I remember as a surgical intern, being totally overwhelmed, and the chief resident sat me down and said, Kyle, I don't care how smart your parents have told you are, or anyone else has told you are in your entire life. You're going to listen to me. I don't really care what you think, but listen to what you're told, work hard, and you'll become a good surgeon. And, that's a little bit old school or a lot old school, but there's some truth in that pearl there, which is, it just takes, there's no substitute for hard work. And anyone who's achieved anything in surgery or otherwise knows that. So,
yeah. And the beauty of it too is like one of the things that I reflected on, over the past maybe 5 to 10 years is that there's a lot of things that I did in life, like going through undergrad, maybe even medical school, where I felt like sometimes I would put work in and I wouldn't get it out. But one thing that I can say for sure that I can reflect on now is as a resident, if you put in the work, you will get it out. If you practice at home or go into as many cases as you possibly can, read, you will get out. It will be rewarding for sure.
Yeah, I mean, for sure. And it's not just the technical presence in the operating room, it's the planning of the operation. I am an enormous planner of surgery, probably to a fault. Any complicated operation I've gone through in my head a number of times before the actual operation begins, because I think that's how you really, number one, do it well, but number two, do it efficiently. And so I think the best residents are those that come in immensely prepared for surgery, many of whom, and they sort of know, many of them know that I like this, but will send me a plan the night before. Here's exactly what I'd like to do for this operation. And I'm like, here you go. You're prepared. You get the 15 blade. Here you go. And so that I hope is not becoming a lost art, which is the just like unending planning of an operation. And I feel very strongly about that.
Well, it's funny you should say that. I actually start on hand for the first time for the next 2 months. And one of the things that all of our hand surgeons do is you send them your operative plan the week before for all the cases for the week. So
I don't
we
miss
do-
that.
No, I mean, I think there's a line somewhere. I don't think like, You don't need to do it for carpal tunnel release, for instance. But I do think there's an element of demonstrating to the person training you that you're committed to learning how to do it, right?
Yeah, for sure.
And I tell the residents occasionally, listen, if I drop dead or I get stuck in another room, you better be prepared to move this operation forward. Hopefully it's the second rather than the first, but you know, you just need it. Like that's part of training. And I think graduated autonomy, I didn't say this earlier, but is super important. And I think we have that in spades in our program. I feel that it's something just so important for training in a careful, sort of concerted way that people can learn how to operate with guidance and with some guardrails, but learn how to do it themselves.
Yeah. You got to one of the points that we wanted to bring up about the residents and preparation and what you thought would make a good resident. And now shifting gears to what a lot of people care about. I think a lot of it's because it's application season, interviews are getting ready to come out. I'm sure you're getting emails. Thinking back to even like the pre-interview season, pre-applications, if somebody came to you as a medical student and said, I'm interested in plastic surgery. Step one, you mentioned you had really good step one scores. Unfortunately, it's pass fail now. How would you kind of guide the interested medical student in becoming an outstanding plastic surgery applicant?
Yeah, I think it depends on the stage of where they are. I mean, I'm sure you also get emails from folks along different stages of their training.
I'm getting undergrad emails now. Are you getting undergrad emails?
Oh yeah. And to be honest, I think for the most part, I respond to those. I try to, if there's bandwidth, but I think that's too early because many times, in my opinion, people don't understand anything about plastic surgery. They may say, "Oh, I like the TV show. That seems cool." But that's not exactly what this is all about for the most part, as everyone knows. Even first-year medical students, when they reach out to me, I'm happy to talk to them. And what I usually do, and I may sound like a crazy person, but I have them meet with me, or I plan to meet with me at 6 a.m. on a Saturday or Sunday. And you'd be surprised at the number of people who respond saying, "Oh, that seems early. Is there another time to do it?"
Really?
Which is a selection
it's a
process
good
in and of
idea.
itself.
I like that.
Yeah, it does thin the herd a little bit. But anyways, when really junior people, first year medical students, I'm happy to talk to them and tell them about plastic surgery, but I encourage them to join our grand rounds and to learn about the field. That is step one.
That's a great idea.
You gotta know if this is something that you like, because I don't have the time. Many of us don't have the time to spend 10 hours mentoring somebody who like a month later is like, "Oh, wow, dermatology seems great,"
Yeah.
So, which can happen, of course. So I think that it depends on the stage of the game. But when somebody is getting into the second, third year kind of, and is really getting serious about it, then it's making sure they're connected with people who are going to help them, mentors. Somebody, I kind of ask them, like, what part of plastic surgery do you think you're interested in now? And if somebody says, "I'm very interested in breast reconstruction," I'm like, "That's great. Let me get you connected to our faculty who are expert in that have research efforts, and we'll get you connected." And then they kind of have to take it from there. So I think helping people get connected to the right mentors is super important, and having an understanding of the field is critical.
Decide, these are the applications that really stand out to me in a positive way. Are there any kind of red flags that you also look out for? But those are kind of like my two big questions.
Yeah, like common mistakes on applications and stuff.
Well, I don't know that necessarily there are a ton of mistakes that people make in applications other than not preparing it really, really carefully. I would say, and this doesn't really happen that often, but like super silly grammatical errors or spelling errors, I think is an unforced error that it just requires a little bit of, that shouldn't happen. And that's pretty unusual. So it's sort of almost a moot point. The things that I look at a lot that I think are very important are letters of recommendation, and particular letters of recommendation from people that and people that know the sort of barometer here, get the difference in the different applicants and things like that. Somebody who is an incredible plastic surgeon in private practice who writes one letter of recommendation every 5 years is going to write a perfect letter of recommendation for the person.
Yeah.
But it's hard to know how that compares to the other applicants. So I really value, a bit provocative, which is maybe the point here.
Yeah.
But sometimes I think, in looking back, that certain people who have the most academic productivity going into residency are those that are the least likely to become academic surgeons.
Yes. So why do you think? I've said this 100 times.
You say that all the time.
I say it all the time.
They
So
don't do any more research once they get in.
Yeah. So why do you think? What's your thought process?
I think that there's a certain gamesmanship involved in just getting to a certain number where it's like the box checking of it. But there are other people who you can tell have a clear passion for investigation about a particular problem. And they also, you get the feeling that they actually care about it. And that's much more meaningful than caring about just the number of publications. And I get the strategy on both sides, but I think somebody that is reviewing applications that is sophisticated about it, and I don't know how many applications I've reviewed over the years, but it's way more than a few thousand, including hand fellowship and, et cetera.
Mhm.
It's a little hard to fool. You can't really fool people who really know what they're looking at to some degree, I think.
Yeah, I always mention, at least in our program or even nationally, if you looked at people that come in with a bunch of publications, it'd be very interesting to kind of follow them and see what their ultimate career trajectory is. And one of my thought processes, it's kind of like with kids, if you drive your kids to do something in a way that they don't fall in love with it, then no one likes that. I don't like the things that I was forced to do, and I witnessed this over and over and over. And so I love the fact that you said that. The only other thing that I wanted to touch on from a conversation earlier is I've mentored a few people who did not match, a couple of them who successfully ended up matching, which is great. But one of the things that when they always kind of talk to me after the match process, I didn't match. Why do you think I didn't match? And some of these are outstanding paper applicants. Yeah. One of the first things I tell them, your letters of recommendation, like, was there any letter that you think could not have been strong? And like an away rotation. And then they start to dig, maybe ask questions, and then meet with the people that wrote their letters. And I'd say probably the majority of those people found that one of those letters was not good.
Or even lukewarm sometimes is enough to push.
Yeah, I think that's right. And there are different reasons that somebody couldn't match. And so I do think for many people, it's good to put eggs in some basket. You have to really direct your attention, not to one program only. You got to show interest, whether it be through rotation or some other way, in a couple of programs. And the signal process, I think, has helped that to some degree.
Should we start to do like cognitive and personality testing?
I think what I have observed happen as these trends about not having step one scores and things is I do think away rotations, and this is maybe not a good thing, but I think they become a little bit more important because you do get to interact with somebody and it's a bit of a known entity. And the more objective things you remove from an application, the harder it is to know the quote product you're matching. So I do think that away rotations have become a little bit more important. And when I look at our track record in our program in the past few years, we've matched a lot of people who rotated with us, and they're great and they're amazing. But I'm also certain that there are some people who didn't rotate with us that would, if they had, would have also been equally amazing.
Yeah, those are great point. I mean, we could talk about this forever. Questions is you're in a very unique position. Fortunately or unfortunately for you, you're in a unique position as you're the program director, but also one of the best hand fellowship programs, and to look kind of into hand applications now and the hand fellowship. And when you're considering both orthopedic and plastic surgery residents going into hand, what helps you think, like, do you think that there will always be a future for kind of this combined entry point for both orthopedic residents and plastic surgery residents interested in hand? Or do you think that that's going to evolve at some point?
No, I think that is critically important to the field of hand surgery, and I think it will continue. There was a time when people thought about whether there should be a hand surgery residency. That was many moons ago, and that kind of fell out of favor. I don't think that's going to happen anytime soon. But I think it's objectively true that to be an outstanding hand surgeon, you have to be a very good plastic surgeon, you have to be a very good orthopedic surgeon, a very good, quote, neurosurgeon, if we call it that, and a very good vascular surgeon. That's just part of what it takes. So I think the best hand fellowships, and I've had a few meetings today about this within our system already, but the best hand fellowships are those that blend the characteristics of both specialties. And I feel very strongly that that is important, in our fellowship, but in many others. And I tell plastic surgery applicants to hand fellowships, you should definitely go to a program that has a strong orthopedic presence, because you don't need to learn how to do, a pedicle flap in the hand. You sure already know how to do that. You're a plastic surgeon. But you do need to learn how to do distal radius fractures and wrist scopes and things that make you a comprehensive surgeon or hand surgeons. Yeah, I think there will always be a role for both.
Yeah. And then how do you evaluate, it's difficult, whether, how do you evaluate an orthopedic applicant versus a plastic surgery applicant?
Yeah, that's great. Because also the different numbers of years of training.
Yeah.
It all comes back to hand, but.
Yeah, totally. I mean, they're very different. And I would go on the record as saying most of the time, the strongest plastic surgery applicants are the best applicants in the whole pool from an academic perspective. Probably because it's so hard to get integrated plastic surgery that people have had to build their CV over time. But with that said, this may be controversial, most orthopedic trained surgeons who go into hand fellowship really want to do hand surgery. They're like, that's what I'm going to do. That's my practice. I want to do hand surgery and nothing more, nothing less. The challenge with plastic surgery applicants, and I really try to ferret this out, when I interview people for hand fellowship, is how much hand surgery do you want to do? If you're a plastic surgeon that's going to dabble in hand surgery until you build your facelift practice, I don't think that our fellowship is the right one for you. And maybe no hand fellowship is the right one for you. And there are some people who do that. And I don't think you need to do 100% hand surgery, but I do think that, you want to have a real focus on doing hand and extremity surgery. To me, it's very synergistic to do hand, peripheral nerve, lower extremity, like all that fits together. That's honestly my practice now. But I think that's an important question. And it's different for plastic and orthopedic surgery trained folks.
Yeah. And I feel like it's what makes plastic surgery great, but also it makes it difficult finding out what you want to do. I feel like a lot of people we've interviewed on this podcast, the reason they choose plastic surgery is because they love surgery. They love operating on every part of the body. There's no limits. It feels like everything's our territory. But I think that brings me back to like the beginning of our episode, which I kind of wanted to ask, but we got sidetracked, was you thought you wanted to do craniofacial surgery. What was the inciting thing that brought you to hand? Was it a specific procedure, or what part of your residency did you decide, I want to go into hand?
It was honestly pretty late. And I think probably even my fourth year, I really enjoyed the technical demands of doing microsurgery and replantation and complex peripheral nerve surgery and functioning muscle transplantation. Like, I just thought that was really the sort of pillar of plastic surgery. I kind of still feel like that a little bit or a lot. But so I really liked the technical precision. I liked the anatomic complexity of the hand. And just the fact that I felt like I could, for my entire career, continue to learn about how the hand works well. And so that's what really, really drew me to it, as well as the functional implications of the operation you're doing in that person's life. Now, everything we do in plastic surgery has functional implications. I totally get that. But I really found that very compelling within the field of hand and upper extremity surgery.
Yeah, that makes a lot of sense. And then the other thing that you kind of alluded to, but is your brother who does private practice, cosmetic surgery. What are those conversations like when you guys talk or have holidays together? Like how you can, I think it's great that you can both be plastic surgeons. And it's another reason why we love this podcast is being a plastic surgeon doesn't really define a lot of people at all. You really need to dive in to see what they actually do. So what are those conversations like on how different your careers are, what you would have done differently, what you envy from one another?
No, well, I mean, listen, the beauty of the situation is that, first of all, our Venn diagrams of practice are literally 100% separate.
That's so funny.
100% in the same field. But if you put him in my practice, he would hate it. And if you put me in his practice, I would hate it. And that's a great thing. That means we're doing what we should be doing. Right?
Yeah.
So I think that's what makes plastic surgery so meaningful, is there's something for everyone. And actually, from the standpoint of like a student that's learning about it, like it's such a great field. You can change your practice over your whole career. You can shift and do other things. That's what makes it so magical. And that's what all of us, I think, love about it.
Yeah.
This shows you how little I know about hand. How competitive is it for an applicant to match into a hand fellowship? Or is it one of those things where you can probably match, but if you want to go to, one of the top training programs, it's going to be very challenging?
Yeah, this has changed a little bit over time. I mean, if you look at the numbers, we have a hand fellowship directors association, we look at this all the time. Where we are in 2025 is that there's almost an equal number of spots as there are applicants.
Oh, okay.
So almost everybody is going to match, which is a good thing. The top programs are still quite competitive. And I'm not going to go on the record saying what the top programs are, but there are a number of really good ones. And I think many of them, again, in plastic and orthopedic surgery. So I think most people will be able to match, but it's a matter of finding, for fellowships, very different from residency, right? It's 1 year, it's specialized. You're like, I got to get myself ready for practice. So yeah, that's where we are with the numbers. hand surgery right now.
And then president of AAHS, what are you most looking forward to in California?
Well, I love the combined meeting.
Yeah,
It's a great
it's a
way
great
to
meeting.
see. It really is. It's a great way to see friends and colleagues. I'm very honored to be president of the Hand Association. It's a great organization. Uh, we've done a number of things over the past couple of years. We have a fellows boot camp now. We just have a lot of new initiatives that I think are going to be very impactful. And so I'm very excited about that. But I'm really excited just to see everybody. And the hotel is a brand spanking new hotel. It's going to be amazing. My good friend Bob Exapa is president of ASRM, so we've really had a great time planning the meeting, and it's going to be awesome.
That's awesome.
That's
a
awesome.
great dynamic.
Yeah.
So if you went back, is there anything that you think that you would do differently?
I'm not a big fan of regrets because we all make the best decisions with the information we have at the time. But I do wish that I had a better statistical foundation for my research. I mean, I really am not a statistician. Unequivocally, I'm not a statistician. But I wish I not only knew a little bit more about it, but cared about the details a little bit. And I'm fortunate to have a great team where people know a lot about it. That's one thing. And I think having perhaps more of a basic science foundation. I'm not a basic scientist either. I'm a clinical surgeon, but I do collaborate with a lot of basic scientists. And sometimes when we're talking, I recognize how much smarter they are than I am. But I wish I maybe understood some of the basic science techniques a little bit better. But those are small regrets, not big ones.
Yeah. It's funny because I did two dedicated years of basic science at the NIH and thinking that I would have the skill set that you just mentioned you'd want. And then it's like whenever I review a basic science manuscript right now, like there's so many different levels of basic science that it's still just like a completely different language.
Mm-hmm.
And I think that just the way life evolves in general is everything becomes reliant on a super specialized person that, you just have to trust your basic science reviewer or trust your superb statistician, but maybe having some sort of just basic, knowledge is helpful.
Thank you again for spending this episode with us. I can't wait for everyone else to hear it. They're going to absolutely love it, especially with application season coming around. But the only thing we haven't spoken about is just, with the very small amount of free time that you have, what else do you like to do outside of plastic surgery? Or if you weren't a plastic surgeon, what else would you do? Or also just how do you like to spend your free time?
Yeah. In my free time, I love to spend time with my family. My wife is super understanding, is amazing. And we have two daughters who are 13
What does she
and
do?
11. So she, for many, many years, was an administrator of a big nursing home and rehab facility. And in the past few years, as our daughters have gotten more involved in things, she's been able to really help because I'm completely unreliable in that regard. So she's been able to help a lot with their family. But I love spending time with them. The two other things that are really my personal interest, though, I'm a big squash player. I love squash.
Okay.
In fact, I'm missing our league game tonight, to be honest.
League.
Yeah.
Wow.
Oh, no.
That makes us feel very special, though.
No. It's all good. I had another meeting before this, but
your wife is really very understanding. I mean, between all these meetings, squash.
Squash is exercise that's worth it. And then the second thing is actually chess. I am a obsessive chess player. I play a lot online. Actually, last year I played over 3,000 games on the year. I did chess.com sent me this thing.
Chess.com, yeah.
Yeah.
There's all this talk about parents trying to get their kids to play chess. Do you get your daughters to play it?
They both do play, but actually I have not pushed very hard because it can become an incredible obsession. I probably am obsessed with it no matter what time. I mean, I operated last night 1:30 in the morning or something, and every time before I go to bed, I will listen to 20-minute chess video that teaches me something every night.
Yeah.
Wow.
Yeah. It's actually incredible. The more you delve into it, it's just insane. It's so beautiful. I stepped back from playing it, but in college I played a lot with my teammates and some of our coaches on long road trips to games.
Yeah.
We play a lot, and chess.com is great because it gets you learn from it. You can play people, you can take your time with your moves and stuff. So it's good.
Well, the game tree, I could talk about this for 2 more hours, but the game tree complexity of chess is absolutely astronomical. And the number of possible games of chess is actually 10 to the 140th power, actually.
Wow.
Think about that. That's an enormous number.
That is crazy. You can tell your passion for it. So we're not even going to talk about it anymore. If you could interview anyone on this podcast, who would you interview?
Good question.
You already have an incredible list of people that have been on here, and I feel honored to be here. I appreciate very much the invitation.
Are you kidding? Yeah, likewise.
I think that somebody that I think would be incredibly interesting would be Dr. Andy Lee.
Yeah.
And the reason for that is
I did my first plastic surgery case with him ever.
So there you go.
Yeah.
And I think that he's had an incredible journey to his current role as dean, as he was at Mass General where I am doing a lot of the same things I am still, and then was at Pittsburgh and Hopkins. And so I think he would be very interesting to interview because he has seen, especially with his role as dean of the medical school, would be fascinating.
Yeah, that's a great idea. All right, Hank, you want to hit the last two?
Yeah, so these are the last two that we always ask. One is, what kind of music do you like to listen to in the OR?
So I usually let the residents and anyone else in the room choose.
It's like chess.
A little bit. But during the toughest cases, I listen to reggae. And my old partner, whom I miss a lot, Kurt Citrullo, who's at USC now.
Yeah.
I'm sorry, he's at Cedars-Sinai now, but he was at USC before. There's almost no way to get really fired up or angry if there's reggae playing. So it's that is my
That's
go-to.
a great thought.
Yeah.
And sometimes the nurses in the room, if things are getting a little tense, we'll just put on reggae, and then I know that I'm like, okay, they're telling me something here. So
I'm going to do that for you, Hank, because you have a temper. So I'm going to start
And then the last question is, what's your favorite surgical instrument?
I like to dissect with the Jake Schnitt. I'm a sharp dissector in general in the hand, but a Jake Schnitt, I like the precision of the instrument. I like the fact that for dissection, particularly around like a pedicle or something, I like the blunt tips. I like a McCabe also, but the Jake Schnitt is one of my favorites.
Yeah, we get that. A lot of people seem to agree with you. That's their favorite.
All right. Well, thank you so much for joining us tonight. I would say that this is selfishly, it's just such a great thing that we get to listen to these firsthand with guests like you, because I've learned so much. So thank you for your time. I'm really sorry you had to miss your game tonight.
I hope they won. I'm going to find out when we get up here now. But I've really enjoyed being here. I enjoyed the conversation. This is an amazing thing you guys are doing. And
it's been a lot of fun.
I've listened to many of them, and I'm going to go listen to the rest of them that I haven't.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.